Hello, I'm Dr. Brandt Gibson, and another common problem that we run into in the foot and ankle is Tinea Pedis, or athlete's foot. So I'm going to answer those same 4 questions and help you understand what's going on with that. So, number 1, what is Tinea Pedis? What is athlete's foot? The truth is, Tinea Pedis is a fungal infection of the skin that usually involves the foot, a lot of times the bottom of the foot, the plantar aspect of the foot, or in between the toes. And because of that, you actually get a pretty significant rash. You can be red, itchy rash. It can actually be scaling. It can be peeling. It can even be a white, stinky area between the toes. It can get secondarily bacterially infected, and so it could be a problem that way as well. So you basically get an infection of the skin. The most common fungus that actually causes this infection is called Trichophyton rubrum, or T. rubrum. So number 2, why does it happen? Well, Tinea Pedis, the athlete's foot, is the most common problem of the feet because we commonly put our feet in moist, dark places. Fungus love moist, dark places. And so you get inside of a shoe and it's a perfect environment for fungus to thrive, and it actually increases that infection, becomes a problem there. So that is one of the reasons that it happens. It can be passed pretty easily in moist areas like in gyms or in nail salons. It can be passed to the skin and actually cause a problem that way. That's why a lot of times people will wear flip-flops or sandals or something in the shower to reduce the chances of having this. The infection gets in on the skin or gets into the skin, usually from an injury or something like that, and you get a pretty good progressive infection of the skin. So we know what it is, we know where it comes from. So what are the things you can do at home? The truth is there are 3 different areas you need to think about when it comes to treating athlete's foot. Number 1 is you need to get rid of or control the infection. So you can control the infection. That can be done with topicals such as melaleuca oil, such as many of the creams like Lamisil cream or Lotrimin Ultra. I usually like Lamisil cream or Lotrimin Ultra the best because they actually are quicker. Melaleuca oil also is quicker, but the idea is you can also look at some of the other over-the-counter or prescription-type medications for treating fungus, and they can actually get rid of this fungus as well. The number 2 is getting rid of the sources or the causes. So a lot of times if you have an athlete's foot, it's a good idea to clean the shower or clean your bathroom and clean your bathtubs with Clorox, with bleach or something that will actually kill the fungus. It's a good idea to clean shoes that could be the source of this, including such things as antifungal sprays or antifungal powders inside the shoes to actually help get rid of the fungus that way. And the whole idea is over a period of time, if you're using the creams or the oil twice a day, you can get rid of the fungus anywhere from 2 to 4 weeks. So number 4, when should you go see the doctor? If you are having significant problem controlling the fungus, or if you find that the fungus keeps coming back, so you keep getting the athlete's foot coming back over and over and over again, you treat it, goes away for a little while, and then keeps coming back, then it's worth getting seen by a doctor just to see if there's something else going on, or if your treatment is failing, it's just not going away, and it just seems to be progressing and getting worse. Again, you should be seen because there are other treatments that may work better. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 157, I believe.